Maria Holder Diabetes Center.
Managing diabetes means treating the whole patient, not just blood sugar.
Welcome to February, the month of love, and you are going to love listening to the next 15 diabetic-friendly minutes on VOB, all brought to you by the Barbados Diabetes Foundation. In today's show, what are you talking about today, Dr. Diane Brathwaite?
We also want to discuss a topic that's equally as important as high blood sugars, and that is the condition of low blood sugar.
Yeah, there's really a lot about high blood sugar for true, but not low blood sugar. I gotta listen to this.
All of this coming up, plus a beautiful surprise, especially for you.
I wonder what that could be.
With the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that can surprise you with how much money you can save by banking with them, Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic, or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
A good February Saturday morning, VOB peoples. You know who this is already. Peter Boyce here. And you know I'm here to remind you how you can stay healthy, especially if you are pre-diabetic or diabetic, by visiting the Maria Holder Diabetes Center located in Warren St. Michael. Whether you need to get your eyes checked for diabetic retinopathy, if you are diabetic, when was the last time you had it done? You're taking too long to answer. Every year, you should be getting your eyes screened, so make sure and call and make that appointment at the Maria Holder Diabetes Center.
243-3937.
There's also foot care services available, because you know if you're a diabetic, it is very important that you take care of your feet, so you can call and have your feet checked out.
243-3937.
Then we have vascular screening. If you feel you might have bad circulation, you were supposed to check it out but you did not have the time, maybe it's time you call and get a vascular screening at the Maria Holder Diabetes Center.
243-3937.
There you can also call and make an appointment to see dietitian Victoria Cox, who can supply you with a meal plan to keep you healthy, because it's not only exercise that keeps you healthy, you know, it is also what you eat, and what you eat can also raise your blood sugar. But you might be listening to VOB and you might be saying to yourself,
You know, son, there is always hear a lot about high blood sugar, but you don't really hear much about low blood sugar. I already hear about that.
and that is what Dr. Diane Brathwaite will be talking about this morning. Here's Dr. D.
We also want to discuss a topic that's equally as important as high blood sugars, and that is the condition of low blood sugar, or what we call hypoglycemia. From a technical perspective, hypoglycemia is when the blood sugar is 3.9 or less, known as millimoles per liter, or less than 70 milligrams per deciliter. But for ease, we often say anything under 4. So why is it important to know about this? Hypoglycemia is not a benign occurrence. The blood sugar in our bodies is designed to operate within a specific range, an allowable range, and when it's too high or too low, it can cause dysfunction to the body. So When the blood sugar starts to fall, you may experience symptoms such as hunger, shakiness. Some people might sweat or they might feel their heart racing. Some people might feel tingling around their lips. And as the blood sugar becomes even lower, there can be issues such as difficulty concentrating, confusion. In more extreme ranges of hypoglycemia, when the blood sugar goes down to the range of 2s or even less, which we really don't want to happen, you can experience things such as coma, seizures, and yes, it can even impact on things like your heart rhythm, your breathing, and so therefore it's quite obvious that we don't want this to happen to anybody. So what causes hypoglycemia? Well, you can get mild hypoglycemias from exercise, but if you have exercise plus a medication that causes low blood sugars, you can experience more intense hypoglycemia. In persons who are not on medication, even in the state of pre-diabetes, you can experience mild hypos if you go without food for long periods of time, and this is because your insulin level in the body is higher, and if you haven't eaten for extended periods, or if you're eating in a way that causes the blood sugar to rise and fall quickly, i.e. you are having more high glycemic index carbohydrates. To break that down very quickly, that means foods that release the sugar quickly, but in the state of pre-diabetes, if it's released quickly, you get a higher spike, but then you also fall afterwards. Okay, so I wanted to point that out because some people don't understand, and they go like, oh, I'm pre-diabetic, why am I feeling shaky before every lunch? And that's because you can have mild hypoglycemias. But let's go on to some of the other causes of hypoglycemia. Alcohol consumption. People don't know this or don't seem to realize this, but alcohol affects the body's ability to produce glucose at the level of the liver, and so therefore if persons are consuming alcohol heavily and not eating, they are a higher risk of low blood sugar. And then of course if you have diabetes and you're on medications which can drop the blood sugar significantly, that might happen, such as the case of the fast-acting insulins or a class of medications called sulfonylureas. Nowadays, a lot of medications are being designed to try to reduce the impact of these hypos. However, when you're combining multiple medications, there is always some potential there for low blood sugars. However, there are some medications which are not meant to cause hypos, I would say, although you may experience mild ones on the background of some of the predisposing factors we mentioned, such as prolonged fasting, missing a meal, exercise such as metformin, the gliptins, and another class of medications called the SGLT2s. So they are not meant to cause low blood sugars. The ones that do tend to cause them, or can cause them I should say, would be the sulfonylureas and the fast-acting insulins. Usually I would say if used incorrectly or used without eating the adequate amount of starches. Okay, and remember, adequate amount of starches are not in excess. Everybody make a fist, and if your fist is big, it's not going to be your fist, it's going to be my fist, which is a small size fist or less of complex carbohydrates is what is recommended. If you are going to be entering a period of fasting and you're using medication, I would always advise you to discuss with your doctor how to manage your medication so that you are not putting yourself at risk of having hypos. I also want to mention a term is called hypo-unawareness. Now this is the case where people are having recurrently low blood sugars. What happens is that the body almost doesn't recognize that it's going into a state of a low blood sugar, and we call this hypo-unawareness. If a person is having a low blood sugar but they're not used to having it and they're sleeping, they will automatically wake up, okay? Or they'll get trigger symptoms for low blood sugar when the blood sugar is just slightly low and not too low. In other words, they wouldn't just suddenly go into a coma. Persons at risk of having more severe hypos would be people who tend to be having recurrent hypoglycemia and they're not fixing the underlying cause of it. Sometimes I've seen some clients who prefer to run their blood sugars a lot tighter and even a little bit low because they want to keep their sugar controlled. However, low is not controlled, and I strongly discourage this because I've seen people who are having hypoglycemia and they're hypoglycemia unaware, and then they can only pick up when their blood sugars are extremely low, and in some cases, they don't even pick them up at all, and that actually puts you at risk of coma and unfortunately even death. So it's something to be very, very aware about. If you are having many hypos, sometimes you have to run your blood sugars a little bit higher, and you can do this with the help of your doctor to bring back your hypo awareness or your low blood sugar awareness so that you pick it up before it drops to very, very low levels.
The Maria Holder Diabetes Center.
Save the date! The must-attend event of the season is back in black and white. Join us for a fabulous evening in support of the Barbados Diabetes Foundation, a cause that matters, with a party you wouldn't forget. Jamming for a Cause comes off on Saturday the 28th of March, 6 p.m. at number 1 Millhouse Complex, St. Michael. You get a welcome drink on arrival, premium food, and live entertainment by top stars Philip Seven, Nikita, Jeremy Goddard, Chris Clark from 2 Mile Hill, Zucchini Innes on sax, Mikey Mercer, and more. Red carpet vibes, VIP lounges and tables are available, but please contact us ASAP to reserve for your corporate group. This is a critical fundraiser, but also serious fun. Mark your calendars now. You don't want to miss this. A fundraiser in support of the Diabetes Foundation. Jamming for a Cause, Saturday the 28th of March, 6 p.m. So don't miss that big fundraising event coming off on Saturday the 28th of March. Jamming for a Cause as we go into our Saturday song of the day. And this next artist is going to be there on the 26th of March performing his song Beautiful Surprise. And you're hearing it right now. Compliments the Maria Holder Diabetes Center and Republic Bank.
Woke up today, my life has changed. Suddenly nothing was missing.
The Maria Holder Diabetes Center.
I just can't explain. Sunshine away comes when you least expect it. But now I know what time will show the things that you believe.
The Maria Holder Diabetes Center.
I knew that they would come when I found someone to share my life. What a beautiful surprise. It on my life was something like now you're by my side. What a beautiful surprise. Oh yeah. Late afternoon, I'm still thinking of you. Suddenly time doesn't matter. It's that feeling inside, and you don't have to try.
Jamming for a Cause, Saturday the 28th of March, 6 p.m.
But now I know the time will show the things that you believe.
Just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done, both me and my fiance, and I can say that I was well satisfied with what they did with the result. Right now the cataract is under control. I would say yes, that is very good. It's very good for diabetic.
Cutting edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
1 in 3 adults with diabetes also has high blood pressure. Don't ignore it.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality. You can do it.